Good afternoon, everybody. I'm Dr. Mitchell. I'm the medical director at the Norman Parathyroid Center in Tampa, Florida, and operate at the Hospital for Endocrine Surgery, where I'm the director of the Division of Parathyroid Surgery. For those of you who have joined us before, welcome back. For any first-time joiners, welcome. We're going to do a question and answer session about parathyroid disease. We've been doing this for a couple of years and it's been well received. So thank you to everybody who sent their questions in. It helps everybody who joins, and these will be posted on our YouTube channel afterwards for those of you who want to look at it again. Well, let's get started. We have a lot of great questions, as we always do, so let's dig right into it. First question, can you diagnose and cure this if the scans don't clearly show an adenoma? It's a great question. It's a really common question, and it's a great point to make. The point is the following. While imaging studies are commonly utilized when it comes to parathyroid disease, what am I talking about? There's really three imaging tests that are common. The two most common being what's called a sestamibi scan. This is a nuclear medicine X-ray, and ultrasound of the neck. These are the two most common imaging tests utilized for parathyroid disease. CAT scans or 4D CT scans are also utilized. Together, these are the three most common used. It's important to know that imaging tests like these have no role in making the diagnosis of hyperparathyroidism or making a decision to treat hyperparathyroidism. Why is this? Because the sensitivity and specificity of these imaging tests is really not very good. The technology for seeing or imaging abnormal parathyroid glands just isn't very good, even in 2025. Probably never will be. And so while imaging tests play a role in this disease, and we do them as well, it isn't for diagnosis at all, should never be used that way, and it shouldn't be used to make a decision whether or not to treat this disease. Okay, so the answer is yes, absolutely, we can diagnose this and cure hyperparathyroidism, whether imaging tests show anything or not, and often they don't. Good question. Okay, next question. I just found out my calcium is high, and my doctor said it could be parathyroid related. I've never even heard of the parathyroid glands prior to this. Can you please explain what they are, how they're related to calcium, and why calcium being elevated is a problem for me? That's a pretty big question, but it's important, and we can review all this. It's really common for patients who are diagnosed with this to say the same thing. Like most people have never heard of parathyroid glands. So what are they? So most people are born with 4 parathyroid glands. Okay, they're small glands about the size of a lentil or a grain of rice. They're small, and they're located in the neck near your thyroid gland. But it's important to know that parathyroid glands are not related in any way to the thyroid gland. They simply are near it. That's how they got their name. Okay, so important point number 1: parathyroid glands are not related to your thyroid. Parathyroid glands secrete a hormone called parathyroid hormone. It's not very creative. And that hormone has one job, and that's to regulate your calcium levels. Specifically, parathyroid hormone corrects low calcium levels back up into the normal range. And that's all they do. Okay, that's how these glands and their hormone that they produce are related to your calcium. In some people, okay, this is more common in women than men by about 3 to 1, but 1 or more parathyroid gland can become diseased and can overproduce this hormone. Typically, this is caused by a benign tumor developing in one of the parathyroid glands. And when you overproduce parathyroid hormone, instead of correcting low calcium back up into the normal range, your calcium becomes elevated. And so who cares? Your calcium's a little high, who cares about that? Over time, hypercalcemia can lead to an increased risk of a number of problems. For example, your risk of having a heart attack goes up. Your risk of having a stroke goes up. Your risk of developing kidney damage and renal failure goes up. And one of the ways that parathyroid hormone makes more calcium available in your bloodstream is to tell your skeleton to dissolve itself and release calcium into the blood. So overproduction of this hormone over long periods of time causes accelerated bone loss and osteoporosis. Excuse me. And so these are the end organ complications that hypercalcemia causes when you have hyperparathyroidism. And the result of these end organ damage problems is that your life expectancy will also go down. In addition to the health-related problems the disease causes, the disease causes a number of symptoms that can significantly impact quality of life. What are these symptoms? Chronic fatigue is common. Bone and joint pain is common, sometimes severe. Neurocognitive deficits like inability to concentrate or short-term memory loss is pretty common. Various mood problems like malaise or anxiety or irritability are common. Insomnia, there's a number of symptoms. We could go on. So quality of life is often negatively impacted by the disease due to these symptoms, and over time it's a risk to your health. Okay? That was a general, pretty long question, but all important points. Good review of parathyroid disease there. Okay, next question. My calcium is 10.8, my parathyroid hormone level is 88. These are both elevated. My DEXA scan, this is a scan that measures your bone density. For those who don't know, DEXA scan states significant bone loss over the last 2 years and a 21% chance of major fracture over the next 10 years. What is your opinion regarding whether I have hyperparathyroidism? Well, my opinion is that you 100% have hyperparathyroidism. Those labs are classic. It's a slam dunk for the diagnosis. High calcium, high parathyroid hormone level, that's how you make the diagnosis. Your bone density being on the low side or showing bone loss, is commonly part of the disease, but it's not in and of itself diagnostic, but your labs are. So you definitely have the disease and it should be treated. Okay, this is a great question. This just, honestly, this question makes me want to hit my head against the wall. So I've been told I have high calcium, high PTH, and a low vitamin D, and yet my endocrinologist says I need to fix my vitamin D before they'll consider surgery. Is this true? The answer is no, that isn't true. And this notion of fixing the vitamin D to rule out secondary hyperparathyroidism or before considering surgery is nonsense. Let me just review how vitamin D plays a role in this disease, okay? And so the way that parathyroid hormone increases your calcium levels, it does 3 things in the body to do this, okay? Number 1, we've talked about this already. It activates cells in your skeleton that release enzymes that dissolve your bone mineral, that releases calcium into your bloodstream. That's one thing it does. It acts in your kidneys, okay, to prevent you from excreting so much calcium in the urine. So you hold on to more calcium in the bloodstream that way. It's the second thing that it does. And the third thing it does is it converts vitamin D to its more active form. Specifically, it converts 20-hydroxyvitamin D to 1,25-dihydroxyvitamin D. So when you're overproducing parathyroid hormone, your 25-hydroxyvitamin D level, this is what your doctors measure when they want to check your vitamin D levels, it's always on the low side. It's being constantly depleted by your parathyroid hormone overproduction. So if you have high calcium and high PTH, it's expected, frankly, that your vitamin D will be low, and you do not need to replete the vitamin D level to figure anything out. That's just what's expected. This is a common mistake or misconception that even endocrinologists, like in this question, make, and it's frustrating to me. So you don't need to replete your vitamin D. In fact, if you take a lot of vitamin D when you're hypercalcemic, it can make your calcium even higher. So you don't want to do that. It also can make your symptoms of your disease worse. I've seen this many times. So if your endocrinologist or if you find yourself in this position and your endocrinologist is telling you to take a ton of vitamin D, I would recommend that you don't do it. Okay, next question. I'm a cancer survivor and extremely anxious about anything growing in my body, obviously. Is there any chance a parathyroid adenoma can turn into cancer if it's not removed? That's the first part of the question. And the answer is no. Parathyroid adenomas don't turn into cancer over time. Okay, certain things do. If you have an adenomatous polyp in your colon, for example, your GI doctor will always remove those because those can become cancer, but parathyroid adenomas do not do that. Okay. The next part of this question is how do you differentiate between a benign tumor and something more serious? So first of all, parathyroid carcinomas, while they exist, are exquisitely rare. I've been doing this for 20 years, and I've probably operated on some number over 10,000 patients. And I have seen in my career 20 cases of parathyroid cancer. And to be honest, that's probably one of the biggest single surgeon series of that disease, maybe anywhere, certainly in this country. That's how rare it is. And it presents a different way from regular parathyroid disease. Extremely high numbers, calciums of 15, parathyroid hormone levels above 1,000. It just presents in a unique way. So it's a really rare problem, and it's unlikely that you have to worry about it. Okay, I think I answered that question. Okay, next question. I've had calcium levels ranging from 10.2 to 10.7 for years. I would consider these numbers to be elevated. But every doctor tells me it's just barely high, don't worry about it. I've had worsening fatigue and anxiety and brain fog, and I'm starting to feel like I'm going crazy. So this person's very symptomatic, obviously. Is it possible to have hyperparathyroidism even if your calcium is never above 11? Yeah, the answer is yes, absolutely. It's a common recommendation and misconception by doctors that you don't have to worry about this disease if your calcium is not above 11. That's an arbitrary number, and it's nonsensical, to be honest. Your calcium is either high or it isn't. And it's not how high your calcium is that denotes the severity of this disease. It's how long you've had high calcium. Because the longer you have this disease, the longer it has to damage your body. So whether it's 10.4 or 10.6 or a couple tenths of a point above normal, or it's 11.5, the disease is just as bad. Okay? So it's a great question. It's a common misconception. It's a common management problem that we see frequently and should be avoided. If your calcium's high, it's high and should be treated. Okay, there's several parts of this question. Are people born with this? What are the causes? More men or women? Is surgery really the only cure? So this is, I guess, 4 or 5 questions. Are people born with parathyroid disease? No. You can develop it at a relatively young age. The youngest person I've ever operated on for this disease is age 10, and I just saw a patient today actually who's 12 years old and has this. It's obviously less common the younger you are. So teenagers can get it, and any age above that. But the peak incidence of this disease are women in their 60s or older. It is more common in women than men by about 3 to 1, but men can get it. What are the causes? In most cases, we call this sporadic, which means we don't know what causes it. The only environmental causes we know of for parathyroid disease are ionizing radiation exposure to the neck, so cancer treatment, for example, or people who get radioactive iodine ablation for Graves' disease. These are the instances of radiation exposure that can cause this disease. Typically, parathyroid tumors will develop 15 to 20 years later. Also, people who take lithium for bipolar disorder for many years can develop parathyroid disease, although in this case it usually affects all 4 glands. Those are the only 2 environmental causes we know of. Most cases, as I said, are sporadic, which means we don't know what causes it. I'm sorry, so there's another part to that. Is surgery the only cure? Yes. There's no medical therapy for parathyroid disease. It is a surgical disease. So the only way to fix it is to figure out which of the glands has the problem, has the tumor, is over-functioning, and to remove it. Okay? Okay. I had parathyroid surgery 10 years ago and was told only one gland was affected. The procedure took hours because it had grown into the thyroid. Could a piece of the back gland have been left behind? I'm fearful for second surgery, but my calcium is back over 10 and my pH is 147. What would you recommend? There's 2 possibilities. 10 years after surgery, it's more likely actually that you've just developed a second adenoma. I mean, it's pretty unusual for this to happen, but it's possible. We do see it. If you had a portion of your tumor left behind, I would expect that you would have developed hypercalcemia again in 3 to 5 years. I've seen this as well many times where surgeons have had a tough time with an operation and they don't take the whole tumor out. It will grow back and will cause disease again, but usually it's within 2 to 5 years, not 10 years. So if you only just developed abnormal labs again, it's more likely that you have a second parathyroid tumor. Reoperative surgeries like this are more difficult, but in experienced hands, it's completely manageable. I personally do probably 20 to 30% of my surgeries each year are reoperative surgeries. You just want to find someone who's really experienced at it. So if you're worried about it, please consider sending us some information, and I'd be happy to evaluate your case. Okay, this is probably a pretty specific question, but the question is a parathyroid cyst a concern? My endocrinologist found one during an ultrasound, and she said we'll follow up on it later. That was 9 years ago. So, maybe they forgot. She treated me for an underactive thyroid sense. The short answer is parathyroid cysts are nothing to worry about. You can have simple parathyroid cysts that don't do anything, or you can have parathyroid, or I should say cystic parathyroid adenomas, which cause parathyroid disease. So if you have normal labs and you've been found to have a parathyroid cyst, or you're suspected of having a parathyroid cyst, there's no indication to do anything about it. It's sort of just an incidental finding. Okay. My calcium has been slightly elevated over time for close to 10 years now, but never high enough for doctors to be concerned. That's disappointing. My urine calcium has remained elevated as well. Can these still be indicators of hyperparathyroidism? I've been passing kidney stones for 16 years. Yeah, these can be indicators. The only thing that's not listed here are parathyroid hormone levels. So without that data, it's hard to know for sure if you have this, but you probably do. If your doctors have not been concerned enough to check a parathyroid hormone level, I would recommend doing that. Kidney stones for 16 years, that's a tough way to live. So I would have your doctor look into this. You very likely have hyperparathyroidism, and successful treatment could alleviate your kidney stone disease for sure. Okay, I have recurrent primary hyperparathyroidism. Parathyroid hormone 315, calcium 10.8, so obviously they have this disease again. I had a parathyroidectomy in 2011, and 1.5 parathyroid glands were removed on the left side. I recently got a scan done and an ultrasound which did not show anything. In this case, would you explore all remaining parathyroids or just go to the right first, even if your scans don't show anything definitive? That's a good question. If you came to see me and we did our imaging test and it didn't show anything, yeah, I'd probably start on the right side. You've got more glands over there. It's more likely that your problem is over there. But I would still try to identify and evaluate your 3 remaining glands. Reoperative surgery, as I mentioned before, is more difficult. The scar tissue and distortion of the tissues that happen with surgery, make it more difficult. But in 2011, it's been 14 years since that operation. Those changes get easier to deal with time, as time goes by typically, and so I wouldn't hesitate to evaluate all of those glands again. Okay. Next question. I just had a nuclear scan because I was convinced that I had hyperparathyroidism, and the scan shows I do have an adenoma, but the local ENT says he's reluctant to do this. Sorry. He's reluctant to do the surgery because I'm in my 70s. What is your advice? That's interesting. The majority of people with this disease are in their 70s. So that doesn't make any sense to me. There's no contraindication to surgery in your 70s. I've never heard of such a thing. We operate on patients in their 80s probably every day that we operate. So it's common. It's such a well-tolerated operation that you can be, in your 70s, 80s, or even 90s and tolerate it without problems. People have looked at this for patients in their 80s and 90s and shown that it's safe and indicated and beneficial to treat this disease even at those ages. So being in your 70s is zero contraindication to proceeding. I would find another surgeon. That's my advice. Okay, maybe this is from a doctor, I'm not sure the way this is worded. I'm seeing a lot of people who are experiencing hungry bone syndrome after surgery, some even 8 weeks out. Most people, including surgeons, don't understand the importance of calcium and vitamin D supplements after surgery. Could you explain the process the body goes through for the first 2 weeks after surgery and beyond? Okay, it's a really good question. And so, we put every patient we operate on a protocol of calcium supplements after surgery because of this issue. What is hungry bone syndrome? Usually this is referred to as a sort of severe instance of this, but essentially after you operate on someone for hyperparathyroidism, you're expected to have calcium levels that run on the low side for a period of time, usually a few days to a few weeks. Why does that happen? For most patients, they have a single adenoma and 3 normal glands. Okay, and so for the entirety of the time that the patient has had the disease or had hyperparathyroidism, as I mentioned before on previous questions, the skeleton has been losing calcium from it. Parathyroid hormone has been causing the skeleton to break itself down and release calcium into the bloodstream. When you cure the patient surgically, that process stops instantaneously and actually reverses itself. The skeleton starts to siphon calcium from the bloodstream back into itself because it finally can, after however many years the disease has been going on. And so because of that, calcium levels in the blood, they go down. The normal parathyroid glands have been dormant. They haven't had to make any hormone because your calcium's been high. There's no indication for normal glands to secrete hormone under those circumstances. So they have not been doing anything for probably years. And it takes some time for those glands to start producing hormone normally. Not forever, not years, but it takes days to a couple weeks for that process to happen. And so your calcium levels are lowering because of the bone effects on your blood levels, okay? You don't have functioning normal parathyroid glands to counteract that by making more parathyroid hormone, and so your calcium levels go down, and they tend to run low. For most patients, this is a mild and very short-term process. Some patients who've had disease for a long time or have higher levels than most, calcium's in the 12 or 13 range with really high PTH values, which usually means they've had the disease for a long, long time. They're the ones who can get into a bit more trouble with lower calcium levels that persist a bit longer, but 8 weeks is pretty long. I rarely see that. And that process of bone rebuilding and some bone loss or calcium being siphoned back into the skeleton happens for even a number of years. But once your parathyroid glands are functioning normally within a couple weeks, they counterbalance that so you don't get into a lot of trouble with low calcium levels. Okay? But rebuilding a bone after surgery is one of the benefits of treating this. While the other end organ complications like renal damage or heart damage or brain damage to the vessels in your brain, those things don't reverse, but bone loss can. Okay. Vitamin D supplements, I didn't mention that. Vitamin D supplements I think is less important. In the early period, it probably is a little bit. We do give vitamin D because it's part of the calcium supplementations that we give our patients. Most low vitamin D levels will correct once the parathyroid hormone hypersecretion has been corrected, and so we don't recommend long-term vitamin D supplementation, but that's an individual decision. Okay, next question. I was just diagnosed with a parathyroid adenoma, and the endocrinologist is not recommending surgery. I have had hypercalcemia for 4 years. My calcium has been coming back at the high end of normal or elevated with PTH values within the normal range. My doctor says since I haven't had kidney stones and calcium hasn't been over 11, surgery isn't recommended. What should I do? The calcium being over 11, that being important, we kind of touched on that in the previous question, so I'm not going to repeat that. Another important point here is that this patient is saying their PTH values are in the normal range. And so this is a common mistake that we see as well, or misconception. So people with high calcium levels, their doctors may decide to check PTH values, and they're found to be in the normal range, and the doctor thinks, hey, you don't have a problem. That's not the case. If your calcium is elevated and your PTH is anywhere in the mid to high normal range, that's inappropriately normal for a high calcium level. When I explained kind of the physiology of parathyroid disease, that should make sense. Okay, the only reason you make parathyroid hormone is if your calcium is low. That's its only job, right? So if you have an elevated calcium level and your PTH is even high normal, it's not normal. You shouldn't be making much, if any, hormone. So even if your PTH is in the normal range and your calcium is high, that's still an indication you have hyperparathyroidism. Okay? If your calcium is high for some other reason, your PTH will be very low, in the single digit or teens. Okay, that's a good question. Okay. I've had symptoms for 7 years, and the patient or the person lists a number of sort of typical symptoms. Finally got labs showing high calcium and high PTH. Why is it so hard for doctors to get doctors to take this seriously? That's a good question. I'm not sure how to answer that. I ask the same question almost every day. What would you say to someone whose doctor told them to just keep an eye on it? Here's an analogy I use, okay, and it's another health problem, and I think it's a great analogy to use here. The other health problem I'm talking about is high blood pressure, okay? And so if you go to your doctor and your blood pressure is elevated, significantly, so let's say it measures 200 over 100, your doctor will take note of that and say, hey, that's bad, okay, that's way too high. If they repeat it and it's still that high, what they don't, so why do we treat hypertension? Because if you don't, it causes renal failure, you'll stroke out, and you'll have a heart attack eventually. That's what untreated hypertension does. So if you have hypertension, if you go to your doctor and your blood pressure's high, what they don't tell you is, hey, your blood pressure's super high, it's really bad. When you stroke out for the first time, come back to the office and we'll treat your hypertension. That sounds ridiculous. They treat the hypertension to prevent you from having a stroke and to prevent your kidneys from failing, obviously. Like, that's why you treat high blood pressure. Parathyroid disease causes all of those same problems: stroke, heart attack, renal failure. And so why doctors tell patients to just wait and see, like, wait and see what? Wait and see your kidneys fail? That doesn't make any sense, right? So don't listen to your doctor if they tell you that. Parathyroid disease should be treated when it's diagnosed to prevent you from having those end organ complications, okay? This is a very specific question, but we'll do it. Is there a link between hyperparathyroidism and Fragile X carriers? I've heard of Fragile X. I had to look it up again, to be honest, and I've never heard of a link between parathyroid disease and Fragile X syndrome or carriers. I looked it up again today just for this, and I did not see anything. Perhaps the questioner has seen something in the literature or something recently that suggests a link, but it's not something that's in the mainstream or that I've heard of. Let's see. I've read that there are only a handful of true parathyroid experts in the country. What happens if I have surgery with a general ENT or an endocrine surgeon who doesn't do many parathyroid cases? What are the risks of an incomplete surgery or missing a second back gland? We feel pretty strongly about this, obviously. It is important to have an experienced surgeon perform parathyroid surgery. It's a nuanced operation. The anatomy is variable. And someone needs to have a lot of experience with the curveballs, so to speak, of anatomy and the embryology of parathyroid glands that the disease can throw at you. Inexperienced surgeons will not have seen those curveballs, and so they'll miss it, so to speak. So experience is really important. What are the risks of an incomplete operation? As I've mentioned before, when there are a couple of questions about reoperative sort of cases or surgery, it's much harder to operate a second time. Really any part of the body, but certainly in the neck. And so for someone like myself who does a lot of second surgeries for failed operations, it's just much, much harder. And so you want to avoid that. Do your best to find, there's limitations about insurance and where you live and travel, I get it. But do the best you can to find the most experienced surgeon that you can. How are we doing on time? Some more questions coming in. Let's skip that one. Okay. Is it common to have thyroid nodules in tandem with parathyroid disease? How do you handle that? It's a good question because, yeah, it is really common. So, as I said before, this disease usually most commonly affects women in their 60s or older. Women in their 60s or older very commonly have nodular changes to the thyroid or thyroid nodules. Very common. And so, to be honest, most of the patients that we operate on have some nodular changes to the thyroid. The majority of these are inconsequential. Thyroid nodules typically don't cause symptoms, they don't make hormone or affect function, they're benign. And so usually the thyroid nodules can be left alone, there's nothing that needs to be done. But we evaluate them very closely. We do an ultrasound on everybody before surgery, and that's one of the reasons. And so any concerning thyroid nodule that we see, it'll be dealt with appropriately during the operation. Okay, my calcium is 10.8, my parathyroid hormone level is 88. Sounds similar to one we already had. I was diagnosed with osteoporosis as well. Do you think I might have hyperparathyroidism? Yes, I do, 100%. You definitely have hyperparathyroidism. What should I do next? you should ask your doctor for referral to the most experienced endocrine surgeon or parathyroid surgeon that you can find, or you should come down here. Go to our website, parathyroid.com, do the intake form. It's really easy, and we'll be happy to take care of you. Let's see, I had an adenoma, this is an interesting one. Had an adenoma removed and was diagnosed with hypothyroidism a year later. Is that common? No, it isn't common. Thyroid function and parathyroid disease are not related, okay? Certainly not hypothyroidism. If they didn't take any of your thyroid out during the operation, then no, it's an unrelated issue, and it's probably just a coincidence. So treating parathyroid disease doesn't, in general, have any effect on thyroid function. If you're already hypothyroid, it's a common question that I get. People take thyroid hormone, usually due to chronic lymphocytic thyroiditis or Hashimoto's thyroiditis. So they have an underactive thyroid, they take thyroid hormone, and they commonly ask, can I stop taking my thyroid medicine after surgery? And the answer is no. As I said before, when I explained kind of the parathyroids and what they do, they are not related to your thyroid function in any way. So if you have an issue with your thyroid function, like an underactive thyroid, having parathyroid surgery will not change that, okay? Okay, I think this is my last question. So will surgery reverse common symptoms? Brain fog, fatigue, insomnia, fragile bones, etc. And the short answer is, in most cases, yes. I never promise patients which symptom will go away and which won't, because they're non-specific symptoms, and there's no objective test I can run pre-op to prove the symptoms are from the parathyroid disease, but they usually are. So the majority of patients show improvement in at least some, if not all, of the symptoms that they're complaining of, if they're common symptoms to have with hyperparathyroidism. And usually that improvement is pretty quick. For example, bone and joint pain goes away instantaneously after surgery. It's pretty cool. The other symptoms like fatigue and brain fog and neurocognitive deficits, usually within a few days or a few weeks. So people usually feel better pretty quick, and most people do. Okay, that's all the time we have. I believe in getting that look that we need to stop. Thanks to everybody for the questions. A lot of great questions, as always. We'll do another one of these in a month or two, so stay tuned, and we hope you join us again. Thanks to everyone who joined. Have a great day.